Okay, Parca Clinical Section 1.2 covers codes development, DRGs, ICD-10, CPT, vital statistics, and morbidity data. Modern patient care relies heavily on specialized codes to indicate diagnosis, treatment, fees, reimbursements. Most medical terms are coded, such as procedures, body parts, measurements, diagnosis, and diseases. The code systems used in radiology are ICD-10, CPT, and DRGs. I know we're on to ICD-11 now, but for the Parca test, they're still talking about ICD-10. So when you want to send information to the insurance companies about what you did, what treatment you gave, what procedures were done, it's all done in these codes. These codes are how you communicate to the insurance company what you did and how you get paid for it. DRGs. DRG stands for Diagnosis Related Groups. In 1983, DRGs became the method by which Medicare evaluated and calculated reimbursement. DRGs work by taking the 7,000 ICD-10 codes and reducing them to about 700 codes that cover all of the ICD-10s by grouping similar diagnostic codes together. So basically what they do is they say, all right, we're going to pay the same whether you did a right hand, a left hand, or bilateral hands. We're going to just put all that together as hand. There's 4 or 5 different views of the abdomen. You can do an abdomen 2 view, abdomen 3 view, abdomen standing, abdomen decubitus. Put all the abdomens together. So basically they put all of these procedures together. They group them together by body part or by a particular disease. It's not always by body part, right? So they just group them all together so that they only have to work with about 700 codes rather than 70,000. ICD-10 codes are an international standard for classifying diseases. It's an acronym for International Classification of Diseases, 10th revision. ICD-10 coding is a statistical classification system that arranges diseases and injuries into code categories according to established criteria. It promotes international comparability in the collection of classification, processing, and presentation of health and vital statistics. And the key word in that sentence is vital statistics. So remember, ICD-10 helps gather vital statistics. Codes are developed collaboratively between the World Health Organization and 10 international centers, one of which is housed at the National Center for Health Statistics. CPT. CPT codes stand for Current Procedural Terminology Codes established by HCFA. AMA works with physicians to establish code definitions. The Relative Value Update Committee recommends reimbursement values to HCFA based on data collected by medical societies on the going rate of services described in the code. So what you want to take away from this is CPT codes are used for procedures. So if you do a hand, it has a CPT code, right? A hand x-ray has a CPT code because it's a procedure. A heart cath has a CPT code because it's a procedure. So procedures are coded by CPTs. Vital statistics refers to systematically tabulated information about births, marriages, divorce, deaths, fetal deaths, and induced terminations of pregnancy based on registration, preparation, transcription, collection, compilation, and analysis of these vital events. Vital statistics data have diverse uses. They serve as a base for public health, social service, and economic planning, and program development are used to track progress toward health goals. So the thing to remember here is that vital statistics have a lot of medical components, but births, marriages, divorce are really not medical events. They're life events, they're not really medical events. So vital statistics is used to keep track of a lot of things, including things that aren't necessarily medical. Morbidity data. Morbidity is the state of having a specific illness or condition, and a lot of people confuse morbidity with mortality. Mortality is being alive or being dead. Morbidity is the state of having a specific illness or condition. So while morbidity can refer to an acute condition such as a respiratory infection, it often refers to a condition that's chronic or long-lasting. ICD-10 codes are currently the cornerstone of classifying diseases, injuries, health encounters, and inpatient procedures in morbidity settings. And so the World Health Organization uses the ICD-10 codes to collect this morbidity data, and then they can compare across continents or countries how many COVID-19 infections there are in the United States versus how many COVID-19 infections there are in England. All right, that's ICD-10 used for morbidity data. Thank you for watching.